If you're looking for a solution to your hip pain, then in this video, I'm going to show you a very quick and simple test that you can do at home by yourself that will help you identify the cause of your hip problems. Hi, I'm Trevor Cicutti, CEO of SpineWise, and if you're suffering with hip pain and you're looking for some help, just click the message below and let's have a discussion and see if we can find out a way to help you. But what I want to talk about today is this quick little test that you can do yourself at home that helps so many people identify the cause of a very unknown problem that triggers hip pain in a lot of people. Before we get to that, let me explain a little bit how this works. So if we look at our brain, we've drawn a basic simple brain inside of our head here. If we look at our brain, what we know is the right side of your brain sends messages down into your right hip flexor, which is the muscle that allows you to lift your leg up. We know the left side of the brain sends muscles down that seems to affect the left hip flexor and allows you to lift your hip up. It allows you to bend your leg upwards. So if one of the sides of your brain doesn't work very effectively, that same side hip flexor tends not to function as efficiently as it should. So really what we want to know is what's affecting this side of the brain. So one of the biggest things that we know that affects the brain itself is problems with your jaw. So if we look at the jaw here, the jaw doesn't actually sit like a normal joint. So as you open and close like this, it actually pivots. The top of the jaw pivots along the skull itself. As it pivots forward and backwards, there's a small area behind it, a little space there, which has a neurovascular bundle. This is where all the arteries and the nerves that supply the jaw are coming from. So one of the problems that a lot of time we see people have is that when they close either too far, or when they close, they irritate that area. When they irritate the area, what tends to happen is we tend to get nerve signals that alter the input into the brain, and the net result quite often for a lot of people is changes in brain symmetry, and the result is changes in our hip flexor function. So how can you quickly see if you can do that yourself? Very, very, very simple. So what we find is, step one, what you want to do is check the strength or the movement pattern within your hip that's causing your problem. So you can do that just basically by sitting down, flexing the knee up, having someone put weight on it and see how strong it is. Even just simply moving the leg up, moving it backwards, bringing it all the way out. Sometimes a little bit of help from somebody else helps as well. And just getting a general overall feel of what the strength in the hip is and what the movement ability is. Once you've done that, the next thing we're going to do is get yourself a tongue depressor or an icy pole stick, and all we want to do is get you to bite down on it. Just like that. Hey, that's simple. All that's going to do is create a level of space. It's going to open that jaw up a little bit, create a little bit of space behind the actual jaw itself, and in doing so, it'll actually just free up that nerve slightly. That freeing up of that nerve will alter the input into the brain, and if that's the cause of the issue or that's a component to your problem, then what we should see is the movement patterns at your hip actually start to change. So step one, check the movement and the strength. Step two, get your icy pole stick or a tongue depressor like we have in this case, bite down on that. Step three, recheck all those findings you had before. Has the strength changed? Has the movement changed in various areas? If it has, there's a good chance that your jaw may be contributing to your hip problems and even your flexibility problems within your hip itself. So anyway, if that's you and you're after a little bit more help, you want some more information, just send me a message and I'll get you some help. Remember, it's all about adding life to your years. I'm Trevor Cicutti, CEO of SpineWise. We'll speak to you soon.